Hi, I'm Nicholas Sinclair, a staff plastic surgeon in the Department of Plastic Surgery at the Cleveland Clinic. What is Botox? Botox is a brand. It's probably the most famous brand that we see, and it's all in a class of medications called neuromodulators, and these are purified forms of botulinum toxin. It works by relaxing muscles, and so it's effective in treating lines and wrinkles that are caused by muscle movements. It also has some additional uses outside of the cosmetic medicine realm. There are many other forms of purified botulinum toxin that behave nearly identical but have different brand names such as Dysport or Xeomin or Daxxify. What does Botox treatment feel like? The number of injections depends on the areas we're treating and how severe your wrinkles are. In general, it's about 3 to 5 injections between the eyes, anywhere from 5 to 10 injections in the forehead, and about 2 to 3 injections on the side of each eye. So when we use Botox for cosmetic purposes, we're injecting it just underneath the skin. We use essentially the smallest needle that they make, and through that needle, we inject very small solutions. It feels usually like a small needle stick or a needle prick. Almost no patients require additional numbing medications to have it done. It takes about 5 to 10 minutes in the office, and you go home right away. Botox is very safe. It is very well studied. There are a few patients who can't have Botox, and those are patients usually that have a history of some neurologic diseases, but in general, most patients are safe to have Botox. It is a very well-tolerated medication. Is Botox just cosmetic? Botox is not just for cosmetic purposes. Anything that is happening in your body that's being caused by overactive muscles or overactive muscle tone can be treated by Botox because, again, it relaxes muscles. One of the most common conditions, especially in the plastic surgery office that we use Botox for, is migraine treatment. It can help us identify trigger sites for migraine treatment. This can either be a standalone treatment or it can be used to aid in migraine surgery planning. It can also be used in overactive bladder. It has some uses in multiple sclerosis and cerebral palsy. Essentially, any condition that's caused by overactive muscle tone can be treated by Botox potentially because it works to relax muscles. How soon will you see results? Within 3 days, you start to see an effect. And it does take about 7 to 14 days to see the full effect of the Botox. Once it reaches max effect, it lasts for probably a few weeks at the max effect, and then it slowly starts dwindling. So the wonderful thing about Botox, if you have problems from it, is that it wears off and it's like it never happened. The terrible thing is if you love it, which most patients do, it wears off and it's like it never happened. So it lasts about 2 to 4 months, with the most common time frame being about 3 months. So that means patients need to come back every 3 months to keep up their results. And if they don't come back, all of the wrinkles and lines that they had before will return.